moved. But that's just an understanding. From a medical point of view, what happens within a quarantine center, number one? And number two, who are the medical... I mean, because you've kind of segued to that with saying that then hire medical staff from Kenya. So is the assumption that the medical staff who will be working within these quarantine centers are American doctors who've been flown in to handle this, and only them?
You know, every quarantine may be set up in different with different level, depending on why it has been set. But ideally, if you go deep into identity of quarantine and isolation, a quarantine, like for example, the one that is the National Police setup around Kenyatta, the region, is that once you're suspected at the port of entry, then you are there to be monitored. They will check the normal temperatures, the normal vitals, to whether there is any indications of any of the symptoms for the disease. And if it happens that within the period, that is the incubation period of the disease, there is no symptoms, then you are free. You are clear free to leave the quarantine unit. But if you develop the symptoms and then the test confirms the disease, and then now you go into the treatment, to isolation and into treatment, depending on the severity of the disease, is when they will indicate, do you need an intensive care unit, or do you just need the hydration? Whatever nature of treatment you will need for the disease, will be accorded accordingly. And as we've seen also with this particular strain of Ebola, there are no vaccines, and there's no particular treatment that has been regimen for it. So most of the time, it's just treating the symptoms, and with the hope that the body will eliminate the virus. And I think the reported cases so far of more than 6 people that have recovered. So that is it. So it has mixed skill of workforce within it. We have the physicians there, we have the emergency medical personnel, we have the nurses, we have the clinicians, we have the pharmacists, we have all the mixed skills within these particular setups to ensure that there is actually proper healthcare. But now, if you get down to the one for Laikipia, because this is something that is happening, but we have no understanding of the components of it. The information from the media is indicating that the Americans and American Corp were bringing their personnel to manage the conditions there. And the other information from America and from the media was also indicating that it was more of a field quarantine, that once they have the personnel, the suspected, and then they get sick or have symptoms, then they will be flown to Europe for treatment. That was the information that was there. This is not confirmed or verified by anybody from either the government of Kenya or from the quarantine base. And that's why we wanted to understand what sort of a quarantine unit was being put there. And if it is indeed open to the Kenyans as well, then in what nature? And does it mean, and it's something we keep on asking, and I think it has been denied by government so far, that they're not going to bring any suspected cases from DRC to the point. You get the point? They say that this is an open quarantine just like the other 23. That can only be confirmed by reality when they actually show it. And that's why we are bringing the concerns that what sort of a quarantine is it.
Yes. Because, because when you talk about it being like any other quarantine facility, and the reason why this is actually as huge and being a discussion point today is because it is being built by the American government in a military facility. Kenyans yesterday tried to access the construction of that quarantine facility. They were not let in because it is in a military facility. Therefore, we cannot be told that this is any other quarantine facility because of where it is constructed and who is constructing it, So that disqualifies that argument to start with. But that notwithstanding as well, we are saying we're dealing with this virus, but we're not seeing research that is going into it, or rather heavy investment that goes into it, perhaps even with support from the United States government. Here we have a story where WHO has warned against the use of Kenya-tested Ebola virus vaccine in current outbreak. The Budi-Buji virus that currently is there is a new strain. We do not have vaccine into it. But would you say, based off information that you do have, that there is research that is going into producing the same, say, in the country, and there is heavy investment on that?
In the country, I'm not certain of, and I think I will be rumor mongering if I speak to it.
Yeah.
But I know that of the WHO, and I think the WHO director has been ideally in Congo, and one key statement that I put that they're actually undergoing they're doing a lot of research to try to get the vaccine for this particular strain, and even to get the antibody treatments for it. So that's actually something ongoing. And if you look at it from the report, it's not really the first time that the Budi-Buji strain is being reported. So it means that there's just been a delay on research on it that I must put. But then for Kenya, for us to really be part of a success to all this process, it means we have to invest in it. And we must not just be reactionary to the same. I know government is saying they have a very good relationship with the Americans and with the other African countries. That relationship can only come up when there's much more value to the Kenyan. And that's what we keep on saying, that we want to see. You see, the Americans have the interest of the public, the American citizen.
Yes.
The same.
It's the number. It's not just an interest.
Yes.
It is the number one interest and priority.
Yes. That same has to be the number one priority for the government of Kenya and the persons in the office. In every engagement, policy collaborations, in partnerships, and that should be the major thing.
Which then brings me to the next question, Daktari. In this interest that we see today, and even in the setting up of this quarantine facility that would see Kenya record its first confirmed case, is this in the interest of Kenyans or in the interest of Americans?
We have indicated it out clearly that when you have a disease in, let's say, like Congo, and then you build a quarantine 2,000 kilometers away from it, then it means that it creates another epicenter in that region. Because then that means that the first case that Kenya would record will be based on that import to the country, which so far have been denied, but that's the reality. And then the management of that is very key indicator to show that will that be spread within that region and in the country. Because see, as much as we don't know the information on how the quarantine will be working, then there's no surety that whatever happens there will be protective to the people. Because the Kenyans, this is a military base, yes, for the Americans, and we have the military people there, and we have different service workers in that particular place. But they interact with the community.
They buy food from us.
And they drink within those particular clubs. That's why we even have, some of them have children there. Some of them have husbands, some have wives there. So you can't just say, now this is a different, citizens are living within the country, within the airbase, then there's no interaction. If we think like that, then it's not possible to prevent spread or an outbreak. But when we know and come out openly and transparently on the situation, then it is easier. And sometimes I keep on saying, what brings the outcry, the reactions of the public and of organizations against some of these particular moves of the government is lack of transparency and the communication. Because if all this is communicated prior in time, understanding is put up in place and plans are put, then I don't think anybody will come up to object.
I think they would come up to object, Daktari.
Yeah.
Because at the end of the day, what we're looking at here